My name is Dr. Kevin Pecca. I wanted to make a podcast that exposes people to the true miracles of life and health. All the guests on this show have been specially picked because they bring something positive to the world. They have some of the most amazing and inspiring life stories. These people have a passion for living, healing, and leaving the world better than they found it. There is something inside these people that made them keep fighting through all the tough times, even when people told them it was not possible. They carried on and made their lives beautiful again. And now they are sharing their experiences with the world. This is the Expect Miracles podcast. Enjoy the show. Dr. Meg Banitch is a third-generation Blair upper cervical chiropractor who has practiced for over 30 years. She has been such an amazing mentor, and I am beyond grateful for everything she has made possible for me. She has just recently retired, and today she shares with us her knowledge, experience, and history of upper cervical chiropractic. Please welcome Dr. Meg Banitch. So today on the podcast, we have Dr. Meg Banitch. Dr. Banitch has practiced the Blair technique for over 30 years, right, Dr. Banitch?
Yes, I have.
And your family has started the oldest upper cervical office in the country, still going?
Well, I don't know if it's the oldest, but it is almost 80 years old now.
80 years. Yeah, it's pretty impressive when somebody comes in the office that was your grandfather's secretary. It's very cool to see. So, Dr. Banitch, where are you from originally?
Well, I grew up in a town outside of New York City, just 15 miles outside the city, so it was a suburb of New York. And I currently live in Florida because Dr. Kevin's doing a great job up there, which allowed me to change locations. But I grew up in the town next to where your practice is.
Mm-hmm. And what were you into growing up? Any sports or anything? Or
I did every sport I could think of, and very competitively.
Yeah.
Thank God I had an upper cervical chiropractor for my father because I've had multiple concussions and injuries. My younger brother and I were pretty much daredevils. We would try anything. So if we weren't playing tackle football or ice hockey, we'd be trying to ride our bikes off of jumps we had made. And so my first concussion probably was on a rope swing hitting a tree.
Oh, man.
And my second one was riding a bicycle into a telephone pole.
Oh, geez. Did you lose consciousness at all during any of those?
The tree was a big problem. I laid on the couch with double vision for a couple of days.
Oh, man.
But I recovered.
How often would your father check you guys?
I don't know if I really remember that. I would say at least every month. But
once a month,
I know when I was in college, I didn't get checked as often as I would have liked. So I was always anxious to go home to get checked.
Yeah. And at what age do you think it was where you decided to go into the chiropractic profession?
I had worked with my father in high school during my summer breaks, and I was just very impressed with the relationship he had with his patients, that he had such a passion, enjoyed it so much. I thought it'd be a great way to earn a living and work for myself, control my own schedule.
Yeah.
But that having been said, I always knew we were a different family. I grew up in a chiropractic family, third generation actually, and we just didn't go to medical doctors. I can remember the first time I ever met a medical doctor was I was in high school and I broke my nose. So I guess my father didn't want to toggle it, so he said, let's get this checked out.
So no vaccinations,
right.
Nothing. That's
we
impressive.
grew up with no vaccinations, no shots, no medications. I've still never taken a prescription drug, and
wow.
I hate to admit it, but I just turned 60. And so our medicine cabinet was full of, Band-Aids and rubbing alcohol, calamine lotion, all those kind of things.
All the natural stuff.
But we'd have to have a bone sticking out or blood shooting out of some part of the body to go to a medical doctor.
Yeah. Can you talk about a brief chiropractic history and include your grandfather's story? Because I've heard you tell me you guys the family had to move out of New York State because of the early days in chiropractic, the law wouldn't allow it. And if you can just do a brief rundown of chiropractic history and your family's history, because it's very interesting.
Sure. I really think it is, and I would hate it to be lost. I think a lot of the young people think it's always been like it is to practice today at chiropractic, and it really has not.
Drastically different.
It's vastly different. I mean, we have other problems today, but they're not being locked up, going to jail for practicing your own profession. So my grandfather grew up in Flushing, New York, and that's when it was right near New York, but it was still farm country. And my great-grandfather had a pharmacy in New York City, or in Flushing. And he was a very successful pharmacist, and you have to remember back in those days, people didn't go to doctors. They went to the pharmacy. They told their symptoms to the pharmacist, and he
really? I didn't know that.
worked up a potion to give them. And so I guess my great-grandfather was called Doc, and he liked giving natural remedies whenever possible. And my grandfather was actually ready to go to pharmacy school when a medical doctor friend of my great-grandfather said, hey, there's this new profession. I'm kind of intrigued by it. You should check it out.
Dr. Banitch, what year do you think it was around what you're talking about?
Yeah, I can tell you. And so he got on a train in 1920 and went to Davenport, Iowa.
Wow.
And the family story I heard was he got really sick on the train. He got high fever and hardly dragged himself off the train. So somebody from the school picked him up and drove him to the Palmer Clinic, and he got his first chiropractic adjustment.
Wow.
So I guess he recovered, and he was dedicated to becoming a chiropractor. And back in the 1920s was really young profession, having only been discovered by D.D. Palmer in 1895.
Yeah.
So the school was, I think, pretty small, but the students there were, very dedicated to and excited to become chiropractors. Well, he graduated in 1921. It was only an 18-month program at the time, and he was only 21 years old.
Wow.
So he, I guess, got a little adjusting table that could fit on the back of his bicycle. And he went out, and he actually started a little practice in Wisconsin because he said he wanted to practice on people he'd never see again. But then he went back to Flushing and opened his practice, and he had a very successful practice all through the Depression and everything. But chiropractors were not licensed in New York at the time, so you were always under threat of being arrested.
Wow.
And in 1938, he was arrested for the second time and went before a judge. And the judge said, I'm going to let you pay your fine and leave, but if you come before me again, you're going to jail.
Wow.
So not being too excited about going to jail for his profession and having a son starting college and a daughter in high school, he decided to look for another state. So he moved across the river to New Jersey, where things weren't that much better. They had been briefly licensed in 1921. They licensed 80 chiropractors, then repealed the law.
Wow.
So he started practicing in New Jersey again without a license, but there was a lot of political movement. It reminds me a lot of political turmoil today, that people are just fed up. They're in the streets. They're demanding things.
Yeah.
So he did move to New Jersey, Montclair, and I'm glad he did. It's a beautiful town. And I wouldn't want to live in Flushing today, so.
So those pictures that you see, the old chiropractic pictures of people picketing outside the jails to get their chiropractor out of jail, those are real pictures.
They're true.
Wow.
I have a book, really interesting book about chiropractic history in New Jersey called A Profession Persecuted by Dr. Vernon, who's a chiropractor. And you can still get it on Amazon used, I think. But it really, if you're interested in chiropractic history, it's fascinating. So anyway, both my father and grandfather were very involved in that political movement. And my father, after serving in World War II, went to Palmer in 1945. And by then it was a 4-year program and all HIO. B.J. Palmer was running the school. So I'm very envious that when my father went to Palmer, he had, 3.5 years of upper cervical.
And for those listening, what is HIO?
Well, HIO was called Hole-in-One, but it was Palmer upper cervical recoil technique. So it was a toggle technique where the patient would lie on their side. And it was the precursor really to what Dr. Blair developed with the Blair technique. Mm-hmm. Very specific x-rays are taken. You're only going to contact the upper bone in the neck and make an adjustment. So both my father and grandfather, well, they knew BJ personally, and they thought he was the best chiropractor ever. And BJ was very ahead of his time. He had a big research clinic, and he had medical doctors in there that would do the entrance exams for the patients that field doctors would send there, and they'd check them out. All they would get is strict chiropractic care, then they'd be re-examined again. And that leads me into why BJ picked HIO or upper cervical. He felt that the most impact you could put into the nervous system was at the upper cervical level, and that only makes sense from a neurological standpoint of view. So he developed the HIO technique, and he was very strict about it. The patients would get scanned, as we say, with an instrument every day at the same time. They would be followed, and they would, if they were holding their adjustments, they would not be readjusted until they went out of pattern or, the leg checks went off again. So my father was indoctrinated with upper cervical, and so were all his friends. So I can remember being a young child and hanging out with his friends, and they really talked about old-time chiropractic and upper cervical, and it was really exciting. So my father went back to Montclair in 1948 when he graduated. Chiropractors were still not licensed in the state of New Jersey.
Wow.
New Jersey was one of the last states to actually license chiropractors. So one of the things that the profession did, the old guys got together and they said, well, how are we going to fight this? And because it really was an attack by the medical system or society on chiropractors. They actually had spies. My father would tell me the medical society would send out people to pretend they were patients. And if they came in your office and became a patient and you treated them, you were going to get arrested.
Wow.
So what the chiropractors did, they weren't idiots. They took pictures of these people, the investigators or spies. So when they go to trial and they'd have the investigator up there testifying, chiropractors would take pictures. So pretty soon my father said you would open your upper drawer and you'd have the pictures of all the spies in your area who you weren't supposed to let into your office.
That is so unbelievable.
It really means that you're developing a referral practice, and if somebody walked through that door that you didn't know was referred by one of your existing patients, you had to really check into them, see what they were up to.
So if they did treat one of those people, they'd go to jail? One of the spies?
Well, actually, they would go to trial, and they would pay a big fine because that's how the medical society got their money to run their licensing board.
Wow. They
would get fined, and they would pay the fine and go back to work. And I looked up one of these fines. A doctor got fined $1,700 in 1946, but in today's dollars, it's $20,000.
Wow.
For actually doing your job, which I think is ridiculous.
Yeah.
So that was one of the things they did, and it was successful. The other thing was they rallied the troops. They got a grassroots effort. They had a group called the Citizens Chiropractic League of New Jersey. And that was about 5,000 people they signed up that would rally, picket, go to assemblies to support chiropractors.
Wow.
And I can remember also hearing a story where they had one of these groups in Madison Square Garden, and they sold out the garden.
Wow.
They had chiropractic speakers, and so these people knew what chiropractic meant to them, the patients, and they weren't going to let their chiropractors go to jail. So yes, I heard of stories where chiropractors were in jail and they'd have office hours. People would show up, they'd adjust them, they'd leave them as long as the jailers were probably taking a cut. So
yeah,
chiropractic has a really interesting history, and I encourage people to really check into it.
Definitely.
So that was pretty much, well, I should say that chiropractic finally got licensed in 1953, but we were under the medical board. So There was one chiropractor on the board and the rest were all medical doctors. And then things went along, and as the profession gained steam, we actually got our chiropractic licensing board, which licensed you,
yep.
in 1989. So I was actually still licensed under the old medical board in 1983.
So was that kind of stressful? Was the medical board, even though it was chiropractic, were they telling us what we can do, what we can't do? Were they really limiting our scope?
Well, I think they were limiting it to spinal adjustments, x-ray, analysis, but if you're a straight chiropractor, that was fine with us.
Yeah, absolutely.
It was only more recently that the chiropractors have tried to, widen the board, the licensing.
Right. Okay. So that's interesting. So you decided to go to chiropractic school, and what was chiropractic school like when you went? What was your experience like?
Well, Palmer was pretty happening there. Those are years. I went out in 1980, and I guess at that time there was a lot of fight with the CCE, determining what would be taught in school and how broad a scope we would have. The funny thing is, though, I grew up thinking that all chiropractors practiced the way my grandfather and father did.
Upper cervically, right? Upper
cervically. So I went to Palmer. My first student doctor in the clinic sat me down and did a rotary break on me.
Like a twist adjustment?
I turned around. They twisted my head around, and I turned around at her, and I said, I don't know what that was, but you'll never do it again. So I quickly found that there were other types of chiropractic, and I sought out a upper cervical student doctor for the future. Mm-hmm. And yeah, I went through Palmer, no problem. And of course, going back, when I started practice, chiropractic was already much more accepted. Although I can still remember people asking me why I didn't want to be a real doctor when I told them where I was going to school.
Yeah,
I can remember my father being called a quack.
Yeah.
But it was much more accepted in the 80s. And the biggest thing is we also were included in insurance companies. Mm-hmm. So that helped to level the playing field, that people would come in if they, if money was an issue, they could go to a doctor that was in their insurance plan.
And what was it like for you coming out of school, your first couple years out in the office? Did you start right away with your father in the office?
Yes, I did. And being the good rebellious daughter, I said, I'm not going to practice the way my father did. I knew all kinds of modern things, new stuff I was taught at school. So having had the Palmer package where you go through about, 8 or 10 different techniques and you become the master of none, jack of all trades, I came out and I did a little Gonstead, a little SOT, a little diversified. It wasn't working well.
Were you toggling? Were you still toggling?
Yes, I would toggle, but I didn't know Blair yet, and I didn't know how to take the more specific x-rays. So actually about 2 years into practice, I was very unhappy. I thought I should get the miracles that I've seen my father get over the years, and I took a look at it, and I said, I don't know if I'm cut out to be a chiropractor. And I really was very depressed and upset when I couldn't help people, or people didn't come along the way I expected, or I'd take x-rays and I'd think it was one listing and I'd adjust them and nothing would happen, and I'd flip them over and then they'd get better. So I was really at my wit's end. I really thought I was going to quit.
Well, it was frustrating because there wasn't a lot of holding going on, or? There
wasn't a lot of holding going on. I didn't feel the results were what I thought they should be. And I probably had unrealistic expectations having just come out of school. Mm-hmm. So my father said, well, before you throw in the towel, I'd like you to go meet Dr. Muncie and take the Blair technique. Now, Dr. Blair had already passed away at that time, so I didn't take the classes from Dr. Blair, but I took it from his successor, Dr. Muncie, who was the greatest man. I had a couple good mentors, him being one, and Dr. Forrest, who I know you've already interviewed, being the other. But I took the classes, and it was like this light bulb went off on the top of my head, and I said, this makes so much sense, and I can see myself doing this, because I think I really liked the analytical part. I had always done well in math and sciences, and I had a protocol I could follow, so I came back all charged up, and once I started doing it, I'm not going to say it was easy to learn, but things started to really fall into place, and I became much more confident. I saw my results skyrocket.
So how did that work for you? You'd have to fly to California to get taught, right?
Yeah, I did. I went to Lancaster, California.
Lancaster, and then when you got home, you would just review everything with your father, and he'd show you a couple things, or? Sure.
I had the greatest advantage of having my father as my mentor, because he had been already doing it for over 20 years at the time. He took one of Dr. Blair's first classes in the early 60s. Mm-hmm. It's very tough for young docs that don't have a support system or
absolutely, yeah,
ask questions to.
Yeah. I was so lucky. I mean, I had a 2-year internship, and I was very lucky just to even have you for that extra year, because I thought I had it all figured out, and then I learned so much from you. It was just unbelievable. So definitely a support system is definitely needed.
Yeah. Well, it's why it's called practice. Continue to learn every year you practice.
Absolutely. So you started getting the Blair down. How long did it take for you to feel comfortable to actually start doing Blair adjustments on your patients after switching over?
Oh, I started doing them right away.
Yeah.
I had been doing some toggle.
Yeah.
And like I said, I was a little bit of a daredevil. You can challenge me, I'll do it. But I can remember the first month I was in practice, my father said, I'm going to the ICA convention. He just disappeared. And I had people walking in, and they'd look at me, and someone would walk out.
Yeah.
He didn't work on appointments at the time. It was walk-ins. And I'm thankful for the people that had confidence in me and let me care for them. But I would say to become really skilled as a Blair doctor does take a few years.
Mm-hmm. Definitely. Yeah. Well, I mean, you've built quite the practice over the years, so you definitely did something extremely right. So, Dr. Banitch, why do you think some students should choose upper cervical over full spine technique?
Well, as I said, Dr. Palmer, B.J. Palmer, researched it and found that the best results and most dramatic results came from adjusting the upper cervical spine. I would say the good thing about upper cervical is you get fantastic results. The flip side of that is you have to be educating your patients, or some people get such dramatic results. They get their one HIO adjustment, hole in one, and they leave, and they don't get educated on what's really happening. So I would say as an upper cervical doctor, you're constantly analyzing and giving the body time to heal. As a matter of fact, Dr. Blair said that adjustments don't make people well. holding the adjustment makes people well. So you have to give the body time to heal. And the beauty of that is it's less physical on the doctor.
Mm-hmm.
So my father practiced till he was 86, the year he died. And I can remember in his 80s, he would still have toggle offs with young doctors and students at Blair seminars. And he had a fantastic toggle. He could still toggle the egg without breaking it, which will only mean something to a few oddballs out there.
Wasn't he even beating most of the students at that age too?
He came in second in the last time they had a competition when he was in his 80s.
Yeah, if you go to one of the Blair seminars and you drop your father's name, most people's eyes light up and just rave about how amazing he was.
So why should students choose upper cervical? Well, unfortunately, most students get into upper cervical because they have a personal experience like yourself.
Yeah.
Where they've tried everything, they're desperate, they try it, and it works for them. But it would be nice if more doctors would get the chance to intern or hear from upper cervical doctors what it's all about. Because I think a lot of students get out of school and they don't have confidence in their adjusting, that's all they need. They have to add a lot of other things to try to heal people. But really, if you're clearing the nervous system upper cervically, you're going to get fantastic results. And the patients love it. Yeah. Having practiced over 30 years, I can tell you, I had so many people come in that had tried other chiropractors, and they found that the upper cervical in our office was much more effective, and they really didn't like having their neck popped and cracked.
Yeah.
So when they would get adjusted, you've probably already had this. They'll look at you and they'll go, "Is that all you're going to do?"
Yeah.
So you have to have that answer down, that standard answer. Yes, that's all you need.
Yeah.
You come back, next visit, and you tell me how things are going.
Yeah.
So, you just have to love your patients and educate them, and they really love upper cervical. Once they get it, they become so loyal, and they literally can't live without it. Like you see, you have people that started with my grandfather, my father, myself.
Yeah.
And they're not going anywhere else.
Yep.
It's made a dramatic impact on their lives, and they will search it out. So really, I think students should check into it, get under care, experience it themselves.
Absolutely, yeah. So where can how would one student get involved if they're getting excited about Blair? How do people get involved in just learning about it?
Well, at some of the schools we have Blair clubs, so that would be the best way.
Yeah.
If you're at a school where there is a Blair club, you already have a group of students. Like you had the benefit of knowing very early on what you wanted to do and going to school with a mission and a purpose of learning Blair.
Yeah.
But I think any Blair doctor in our society, if a student called them up and said, "Can I shadow you for a day?" would be open up their office.
Absolutely.
And more than happy. I've had that happen many times in my office. People call and say, "I've heard about Blair and what it can do. I'd really like to see it in action." So that's the best way.
Yep. And can you just touch briefly on the annual seminars?
Every year we have an annual conference, and it's 2 or 3 days of intense upper cervical. And it's just great because you get to see your friends from all over the country. And I'd encourage students to come to that. We usually have a very discounted rate for them, sometimes even free rooms. Yeah. And our next annual will be in October in Nashville. Yeah. So if you can make it to that, I'd highly encourage everybody, any student interested in Blair, to come to that.
And you get to meet all the doctors, and you can gravitate to which one you feel fits you best. And like you said, mostly everybody is very open, and they'll tell you everything you need to know.
Right, exactly.
Yeah. Okay. So, Dr. Banitch, you had a very successful practice for 30 years. What are some of the more amazing cases you've seen in your office?
Well, I have to say I've been retired now 6 months, and my brain doesn't work as quick as it used to. Sometimes when you're in your office, you just expect miracles, or you see miracles every day, and don't seem that big a deal anymore.
That is true.
So every once in a while, I like to go back and read through my testimonial book.
Mm-hmm.
One case that really stuck out with me was a child, and I'd have to say kids are great because it's so exciting to take care of children in the office. They're not coming in for low back pain or sciatica. They're coming in because they have some serious health issues.
Yeah.
You can make a change in a young person's life when they're that young. You've changed the course of their life.
Absolutely.
So I was able to help kids with asthma, bedwetting, constipation, chronic ear infections, motor tics. But one case really sticks out in my mind. It was the 6-year-old daughter of a woman in Montclair. And first she sent me an email and explained what her daughter had. Mostly bedwetting was her chief complaint, and asked if I could help. And I wrote back and said I could. And the interesting thing about that is she was not a patient in my office. She had just probably read on the internet, chiropractic or upper cervical and bedwetting. So I said, well, do you want, please come in and for a consultation, and do you want to become a patient first so that, she'd be more comfortable with it? Well, she didn't have a problem with that. So I started taking care of this 6-year-old girl. And that was one of those amazing ones where toggled her the first time. It was like flipping a switch.
Yeah, what happened?
She was 6 years old, but never had a dry night, her mother said.
Wow.
Which is okay when you're in diapers.
Yeah.
When you're supposed to have gone through potty training, and both your parents are exhausted because every night they get up and get the kid out of bed and take her to the bathroom. If they forget to pull on the rubber panties, the bed's wet. And she said it was really having a whole impact on the whole family. So after, not only did her bedwetting clear up, she had chronic constipation. And she said that was also like flipping a switch. She had normal bowel movements again. And thirdly, she had always had temper tantrums.
Really?
And she said after she got cleared, no temper tantrums. So the mom, as soon as the kids started misbehaving, would like bring her in and have me check her. And sometimes she'd be off, sometimes she wouldn't. Yeah. But if she had a wet night, she'd definitely bring her in. And bottom line is probably a year later, she doesn't have any of those problems. She's not constipated, she's not bedwetting, and her mood swings are not like they used to be. So she just wrote me a nice testimony about how it impacted the whole family, her sister, her husband, herself. Yeah. And that was really gratifying.
How do you think the upper cervical is affecting the bedwetting and everything? How do you think that's making that go?
We know that the nervous system controls everything, all the body functions. Mm-hmm. And your brain is like this supercomputer analyzing information from every part of the body and making little corrections to send proper information back to those parts of the body. So, I don't know, with bedwetting, it could be bad information in. Yeah. Or bad information out. So it's either the muscle control or the feeling that you have to go to the bathroom, or the unconscious sphincter control that we're not walking around peeing on ourselves. Our body knows it's not appropriate time to go. So neurologically, every function in the body is under control of the brain and the nervous system. And so when you make a specific correction, and we did it to the upper cervical, we didn't do it to the nerves that are directly coming out of the bladder. The body made a correction and brought itself back to homeostasis and proper body functioning.
Amazing. Absolutely amazing.
So another case I thought of, because I know right now you're getting Meniere's patients coming out of the wall.
Every week, yeah.
Every week. Because that's one of the most debilitating diseases. For people that may not know, Meniere's is a problem in the inner ear where you just start getting dizzy, vomiting, and you can even get drop syndrome where you're just walking along and you fall over because your body can't keep its balance. So one patient that comes to my mind was Maria. She worked in Manhattan. So every day she'd get on a train and go to work. And she never knew when one of these episodes was going to hit. So she would get halfway to work on the train and maybe it would start, or she'd get in her office and it would start. And she'd be vomiting and so dizzy she couldn't walk. And that had to be terrifying.
Absolutely,
She'd have to call her husband to drive into New York, pick her up, and then drive her back home. So she started care and started seeing results immediately, but she would still have episodes. But the key to upper cervical is getting the patients to stick with it. Yeah. Because sometimes, as you know, they'll get a really great symptom relief or change initially, and then they can have relapses or they can go through tough periods. So you have to really get the patient to understand what's going on and the process it's going to take. But if people stay with you 2 or 3 years, then they get maximum potential to heal up properly. And she did. She's probably still your patient because she even feels the hint of a little bit of dizziness or that. She'll be in your office, and I don't think she's had any real big blow-up Meniere's episodes recently, in years even. Yeah, good. And I just want to say one more case, Jack. This is the case where you should never give up trying to educate people. I know I was always disappointed when I would talk to people and they'd say, that doesn't sound like for me, or I don't think you can help me. Or even your friends, if your friends don't even come in the office, you wonder, like, what did I do wrong? Or they don't trust me. But sometimes people just don't get it. Yeah. First year in practice, I had a really nice lady come in and she got good results. and she wanted her husband to come in, but he's like, I don't need that. I don't need that. It took her 7 years to convince Jack to come in.
7 years, huh?
7 years. So Carol finally convinces Jack to come in. Now, Jack comes in, and he's a pretty powerful businessman and no, nonsense stuff.
Yeah.
But he's also in his 70s and has severe arthritis. I'd say he already had about 3 joint replacements. All his hands and feet were puffy and, from inflammation and just really bad shape. And so I did my thing. I told him about the chiropractic story, took the x-rays, adjusted him. Now the afternoon goes on, and 2 hours later, I should say, I adjusted him, and then he had to drive to a business meeting in Philadelphia.
Oh, wow.
So you really don't want your patient after their first Blair adjustment to hop in a car and drive 2 hours, 2.5 hours if you can help it, but he had to go. So 2.5 hours later, the phone rings, and my assistant comes back and says, Jack's on the phone. I was like, oh, boy.
Yeah.
It's like you're holding the phone a foot from your ear. You're not sure what's going to happen. Well, he said he wanted to call me because he said he's felt the best he has in years.
Wow.
So here's a man in his 70s, total degeneration of the spine, and just that one adjustment, he noticed a dramatic improvement. So that's why I say you really have to continue educating people and never give up.
Yeah, definitely. Absolutely. So, okay, that's perfect for the cases. Anything else you wanted to talk about or touch on?
Well, the last 2 questions you had, why it's so important to take care of the person in front of you?
Absolutely. Yeah. So I remember my first week or so in practice, I think I was telling you this when you came up to visit last month, but the highway got shut down and everybody showed up at once. There was 10 people in my waiting room, and every time I peeked around the corner, everyone's just looking at you like, when am I going to get seen? And it was a very overwhelming experience that I couldn't prepare myself for until it happened. And I always remember you saying, the most important thing is just taking care of the person in front of you, making sure you're giving them the most undivided attention you can, and then see the next person. And that really stuck with me in that moment. And I learned that from you. And where do you think you learned that from? And how has that served you over the years?
Well, I totally agree that if you're feeling overwhelmed, you have to focus on what's in front of you. Because if you're focused on the 10 people sitting outside waiting for you, that's a bad thing.
Yeah.
And it also doesn't do justice to the person in front of you, because now having been in other offices, gone to other healthcare practitioners, I would say you can tell when somebody's listening to you, or somebody's thinking about their golf game or their date later, whatever. So it's really important to connect with that person, even if it's only a short piece of time. Give them your full attention. Mm-hmm. And they really feed off of that and know that. And I think they'll also be more respectful of your time. They're not going to want to hold on to you for 15 or 20 minutes if they know other people in the office that are waiting to see you. You can have really good quality time with a patient in just a few minutes.
Yeah.
You may be the only person that's going to listen to them.
Yeah,
and sometimes, I don't want to be a psychologist, but sometimes you have to be. And most of the time it just means listening, validating their pain or their problem, giving them hope. I mean, so many times people would start breaking down during the consultation saying, doctor, if you can't fix me, I don't know what else I'm going to do, because I spent so much money and I've gone here and here and they tell me there's nothing they can do for me. So really focus on the person in front of you, and you will be rewarded in not only your own concentration, but they will become very loyal and love you to death.
Absolutely. Yeah. And another thing is, too, I find when I'm just going too many days straight and working too much, it can kind of show up in the office. How did you balance work and fun and vacation and just a balanced life over the years?
Well, I do think that's a really key issue. If you're not 100% in your office and be able to give 100% of yourself when you're in the office, you're approaching burnout and you better do something about it. I saw too many old-time chiropractors that they didn't have a good balance. They lost their families, or they lost their health. They had guys just dropping dead of a heart attack, And if you truly love what you do, it's really not work.
Yeah, very true.
I know that's how my grandfather and father practiced, so I saw that in their practices. But we also had family time, and we did things together. Not according to my mother, but it might mean our vacations were going to homecoming at Palmer every year, but it still was family time. And so I think it's important that when you need to balance out your life, have good friends, have good relationships, have great friends in chiropractic, and I have no problem with that balance. As you know, I took a lot of vacations.
Yeah.
I had the fortunate situation of working with my father for 25 years, so I could go away without worrying about the practice. Mm-hmm. But I do think that you have to take time to yourself, and it doesn't have to be a lot of time. Sometimes it's just 2 days, and you come back all ready to go.
Absolutely.
Sometimes when you get a little bit down, attending conferences with your friends, Blair meetings for me were really pump me up, give me direction, get back on focus. So I do think it's important to take time, and even if it's only just a 3-day weekend or 4-day weekend once in a while, just to get yourself all back on track.
Rejuvenated, yeah, definitely. So speaking of balancing work and social life and vacation, how are you enjoyed being retired?
Well, I've only been retired 6 months, but so far I've really enjoyed doing what I want when I want, and not feeling responsible for a lot of other people. Yeah. And I can't say that that's going to last forever, but right now I'm enjoying it. And one of the big pieces of that puzzle that I could make a latitude change and move down here to Florida so I could sail and do outdoor activities I enjoy, and not shovel snow. Finding you. Yeah. We're very much alike, and I know you're going to take great care of all the patients there, and that you're dedicated to chiropractic and Blair. And you're a very good communicator, so I think that you're going to do great up there, and that gave me the peace of mind to explore the possibilities for myself.
Oh, I am forever grateful for you, and I think you know that, and you have made this whole thing, it's a dream come true. Just you handing over the practice has just been a dream come true for me, and I can't thank you enough, and I really appreciate it, and it's been amazing, and I'm so glad I got to even work under you for a year and learn so much. It's been amazing. So thank you.
Well, thank you. And I wish you all the best, Kevin. And thanks for having me on your podcast.
Absolutely. Thank you, Dr. Banitch. I'll talk to you soon.
Take care.
Thank you, everyone, for listening. My private practice is located in New Jersey at Montclair Upper Cervical Chiropractic. If you have any additional questions about today's podcast, other episodes, or any questions about Blair Upper Cervical Chiropractic in general, feel free to visit my website at drkevinpecca.com or subscribe to my YouTube channel at Dr. Kevin Pecca. Hope you enjoyed the show. Cheers.